Hi friends, today topic is about type 1 diabetes mellitus. Type 1 diabetes mellitus is an autoimmune condition in which immune system destroy insulin making cells such as beta cells in pancreas not to produce insulin. This concept occurs in autoimmunity. Autoantibodies destroy beta cells in pancreas not to produce insulin. In normal cases, insulin is produced by beta cells in pancreas to enter glucose from ECF to ICF. Type 1 diabetes mellitus are usually occur in children and young people, so that they are also called juvenile diabetes. Secondary diabetes is due to any trauma, injury, or any infection. Can stop the synthesis of insulin from beta cells in pancreas. This is not occur due to any autoantibodies immune system complexes. Type 1 diabetes is an autoimmune disease. Various symptoms arise in startup of type 1 diabetes are excessive thirst, frequent urination, bedwetting in children, excessive hunger, unexplained weight loss, fatigue, blood vision, slow healing of cuts and sores in hands or foot, vaginal yeast infection, diabetic insipidus. If diabetes untreated can cause life-threatening complications symptoms such as diabetic ketoacidosis or other symptoms such as fruity smelling breath, nausea and vomiting, abdominal stomach pain, rapid breathing, confusion, drowsiness, loss of consciousness. If you know very well, insulin is an hormone that enters the glucose into cell from ECF. Cells use it as a fuel. Glucose is useful for making ATP energy to maintain cell function, cell different properties. If beta cell damage of pancreas cannot produce insulin in our body, so that glucose cannot enter the cell, high glucose levels in blood occurs, so this is known as hyperglycemia. Hyperglycemia occurs in type 1 diabetes mellitus. Here are the following causes of type 1 diabetes are genetic or environmental factors. Genetic is due to any from parents, genetic mutations or environmental factors such as various viruses can mutate our genes, or some UV light radiations can alter the function of genes, or any high proteins can cause type 1 diabetes mellitus. Dehydration is involved in type 1 diabetes mellitus. It is the main problem in type 1 diabetes mellitus. In type 1 diabetes mellitus, excess water is removed from body through urination. Water is lost from bodies, so dehydration occurs in type 1 diabetes mellitus. And serious symptoms such as complication of diabetic ketoacidosis occur in type 1 diabetes mellitus. Breakdown of fats and convert into ketones in liver and becomes acidic, and blood becomes acidic. In this case, fats can break down into ketones and blood becomes acidic. This is case gluconeogenesis occur. Gluconeogenesis is that glucose is making from non-carbohydrate source. Too much breakdown of ketones from fats can cause blood is acidic. You know ketones are acidic in nature. And different type 1 diabetes risk factors include: if you are younger than 20, if you are white, or if you have any family history, if you have any parent or sibling with type 1 diabetes, can you have already on risk to take type 1 diabetes mellitus. And various laboratory diagnoses can include blood glucose test to detect glucose levels in your blood, random glucose levels, not in fasting or any consuming any oral drink. And other is glycosylated hemoglobin test, HbA1c, can detect your last 3 months glucose levels. Antibody test such as ELISA, urine analysis to detect ketones and glucose in urine. Arterial blood gases to detect oxygen and carbon dioxide level in your body, in your blood. And how it can be treated? It can be treated through regular exercise. Insulin intake can reduce the type 1 diabetes effect. Blood glucose monitoring, regular monitoring tests include to treat with this, and diet plan follow to treat with the type 1 diabetes mellitus.